There has been mixed reaction on whether the signing of the National Insurance Bill into law by President Cyril Ramaphosa will bring much-needed changes to the health sector in the country. But some have questioned the timing, as South Africa will be going to the polls in just 12 days. Will signing the NHI into law work in favor of the governing party at the polls? Let's now unpack this with Professor Terrence Kommal, who's an extraordinary professor from the Northwest University and also the CEO of Medical Expert Consulting. Professor Kommal, thank you so much for making time for us this morning. As I said earlier on, that in February during the State of the Nation address, the President said that he was looking for his pen to sign the bill into law. In May now, 2 weeks before the elections, the bill is signed into law. What do you make of this timing?
Good morning, Aldrin. I absolutely do think this play looks very political and appears directly linked to the elections. One has to keep in mind that the green paper for the NHI came out in 2011. The white paper came out 9 years ago in 2015. And as you rightly said, the announcement came out in February. But the timing seemed to be optimally packaged around the elections to create confusion about what the NHI will do and what the government and or the ANC intends to offer people, and create massive confusion around a well-intended thinking, but a very, very poorly thought-out act or bill that's now become an act, in where the granular detail is clearly missing.
Yeah. So in terms of the timing, and considering once again that all of this, the discussion, for instance, started about 20 years ago, 15 years of trying to craft the law. And if you look at the current opposition, do we really blame the president for delaying? Could it be perhaps that what happened after December, after the NCOP also passed the bill, that the president was still being canvassed by some people who are saying that he shouldn't sign the bill into law, and that's the reason that we had this particular delay? Or is it point blank clear that this is happening just before the elections? The ANC is trying to influence the electoral outcome.
I strongly believe that there may have been some lobbying, but I think that lobbying has been happening for years. But what is more critically important is the exact timing 2 weeks before the election, because it's not just lay people, it's professionals who are asking the same question. Well, can I go out and cancel my medical aid? Because just yesterday, the Secretary General of the ANC, and I had responded to some of his tweets, he started a conversation of saying, well, the NHI is here, and this is brought to you by the ANC. He then made comments of, well, actually, it'll take 5 to 10 years to implement. And then 5 minutes later, he puts out a new tweet saying, from 2 o'clock today, everybody will have access to all kinds of healthcare. So there seems to be very clearly mixed messaging of what the NHI will do, what it will not do, and how people will directly benefit from what the Act intends to do. Let me be clear, Aldrin, I'm a strong supporter of what the Act intends to do, universal health coverage and universal access. The challenge we have is the timing and the lack of detail of what will be done, who will do it, and how will it be implemented, and most importantly, how will this be funded?
Yeah, I just quickly want to go back to the issue around timing, and then we'll deal with the other issues that you are speaking about now. So, making reference there to the Secretary General of the ANC, and I have to say that I was having a conversation with someone and saying that this is actually what I do expect, that the ANC's campaign message will change, and the message will be somewhat along the lines of you have an NHI Act, which will now allow you to go to a private hospital. It is the ANC that has brought you that. However, though, you need to keep the ANC in power for you to have access to that type of quality healthcare that we are speaking about.
Absolutely. And I think that is the intent of the messaging. That is why it's done now and didn't happen in February or March, because it looks like, and this is the perception publicly and something I believe in, it is packaged enough time to be done just before the elections to say, well, if we don't vote for the ANC, we're not going to get access to this. And that's very similar to previous conversations where councillors and even some of my staff have said, well, the councillor said, if I don't vote the ANC, I won't get my social grant.
Yeah, but does this not also then play into the hands of the opposition, like, for instance, the Democratic Alliance that is saying that it's going to go to court, and there are, of course, some people that are opposing the NHI, so meaning that perhaps maybe the Democratic Alliance could win some of the votes, including those political parties that are opposed to the NHI?
I don't know if going to court is going to help anyone at this stage. I think going to court is an eventuality because there's this very different interest in the matter, and the lack of clarity of the act is where the concern is. But I think the message is clear that the ANC timed this well, and the other parties can say, well, it's foul, but the difficulty of complaining about the act is it then almost talks into the narrative that the ANC wants to put out, is there's a particular group of people that want to maintain the status quo. So I think it's well played in terms of timing, but the reality is the act lacks all the granular detail for a realistic implementation at this stage.
Yeah, some of that detail, of course, is around funding, but the state has said that that money would be coming from our taxes. How exactly that will happen, it is still unclear. Some people are saying that we could see the direct tax deductions from people who are actually employed from their salaries.
Absolutely. The white paper, interestingly, Aldrin, is the white paper, which was now 9 years ago, had a lot of granular detail of packaging, funding models, consultation. And I did an analysis, and there's more than 100 key discrepancies between what the white paper had and what's not found its way into now what we call the Act, which is concerning. But the underlying concern is a comment passed by the minister yesterday to the media to say, well, 18% of the healthcare system has 250 billion, and there's abuse by doctors and hospitals and other key players, which I completely agree with. Are there concerns with the healthcare system in private? Is there abuse? Absolutely. But what the minister failed to acknowledge, which was a fallacy in his argument, is that 250 billion is money that the private industry is self-funding. People are contributing to that for their benefits. It's got nothing to do with government. But government now wants to tap into the funds that people are paying themselves to fund the medical aids and the medical funds and say, well, give us that money, we'll fund it. But who's going to make those kind of contributions for a system you intend to roll out?
Yeah, and if you look at the explainer, I don't know if you've seen the explainer that has also gone out from the Department of Health. The question around, for instance, is NHI an affordable system? The answer that they give there in the explainer is yes. The World Health Organization has stated that countries must pursue a universal health coverage with the current resources allocated for health and what countries are able to afford. But does that answer the question about whether it is affordable?
Absolutely. And if you look at universal health coverage under the Constitution and whether it's the WHO, resources allocated is an allocation from government, not to then ask people to say, well, whatever you're contributing in your private capacity through private medical aid, now give it to us as government and we'll run that. In 2012 and 2013, I was in a session at Harvard with Professor Bolshaw from Harvard, in which Minister Partler was present. And the professor from Harvard was clear to say, Minister, you're trying to build a national health system. You want people to run into a system that you will control. If you have a national health insurance, you give somebody a card and they make a choice. So if you're injured in Alexander in Johannesburg, you have a choice between going to Alexander Clinic, which is a government facility, or private facility in the center of Sandton. And that choice is yours as a consumer. But what government is building and what it intends to say through its referral-based system, which completely lacks clarity in the Act, is government will tell you where to go, which is aligned to what the British have, and not a health insurance where the consumer has the choice.
Yeah, but isn't that part of a referral system that is already in place as well?
That's a referral system within the government sector. But now when government says, well, we'll decide where to send you across the country, including private facilities, there's complete lack of clarity of how that will be managed. For example, let's take a case of Mr. Dlamini, one of my patients. Will he be able to come back and see me or my colleagues in various specialist care facilities? Or will government then keep him mixed up in a referral system of who refers to who every time he needs a renewal of his prescription or an annual checkup? And that clarity is completely missing.
Yeah. Another element to this as well is that, of course, the fund that will be established will become a single payer and strategic purchaser. So we've been told as well that this would mean there would be more benefits that come out of this, and it will also push some of the prices down. But I just quickly want to go back to the Minister of Finance and what he had to say during his budget speech. The Finance Minister said that they found government pays 2 times more than market prices for ICT hardware like laptops, when it should actually be getting them at a discounted rate because they are bought in bulk. So you have the prices that are being inflated, and we know that government is already stressing about this, and it is a major issue because it also speaks to the issue around corruption. Do we know how exactly government would ensure that it gets better prices out of procuring from a single fund?
I find it quite humorous that the minister said that, and I've served on various government boards. When you sit in these boards, you're told by the management teams that implement the day-to-day operations. Well, we have to go on tender, and when we're on tender, we know we're going to pay double pricing, and because it's related to some connected comrade, we have to do that. What government actually needs to do, and let's use an easy example of an iPad. If government, the retail price of an iPad is 10,000 Rand, and on tender they're paying 20, if government goes to Apple directly and says, we need a directive from Treasury to confirm that we will single source this because there's only one supplier, and we will buy in bulk across for all government departments. So government becomes a single purchaser used through CETA or whatever mechanism they want to use, and you bring that down to 8,000 or 6,000 or whatever pricing is possible. That will centralize purchasing. But what government does is exactly the opposite. You have one connected individual who gets a tender in one government department at a significant price, and then they transversal that contract across few hundred entities across government, so that one fixed negotiated price at an inflated price is what is offered to government, and it's maintained as one contract, so you don't recontract. And that is where I have concerns, is there's no focus on reducing pricing. It's nice to say that in healthcare, but again, the question is, who have you negotiated with? What have you benchmarked your pricing with? Show us some studies that you've done to know, like the minister said yesterday, a cesarean section cost 2,000 Rand in his mind, or a operation costs X amount. Where's the data for that? Because government currently runs a federalized system. Each provincial department has its own healthcare management system, and there's a long delay on how systems are put, how the data is put in. So show us how you're finding this and how you'll negotiate, and then maybe we'll have a little bit more faith on the grand plan. Again, the NHI is fantastic in concept for universal healthcare coverage and access. The granular detail that's missing makes it look more like grandstanding at this point.
Yeah, and of course, this corruption is not limited to the public sector, in the private sector as well. Remember the investigation also against Mediclinic and the allegations that some of their former staffers have made around the manipulation of billing or coding at either hospital or at group levels as well. But once the NHI is implemented, do we know how the state will be able to circumvent this particular issue?
See, that's the challenge. Government hasn't told us how they intend to do that, because the medical funders have been trying for many years to get that right, and they haven't been able to get it right with this alleged 250 billion budget that the minister referred to. There is massive perverse incentives in the hospitals, and I've led a facility for a very long time. The specialists use the specific diagnosis codes that they use for admitting patients. They charge up to 500% of tariff. So if a patient goes in with a fractured wrist, it won't cost the prescribed 2,500 Rand to fix that wrist. They charge 25,000 Rand. And the hospital itself, and I'll give you a classic example. My own mother was admitted to a hospital for a 3-day stay, and a hospital in Pretoria charged just over 100,000 Rand for ICU, when the prescribed tariff was about 12,000 Rand per day. And when I asked my colleagues how was the prices inflated, he was very clear to say, the hospital has 400 optional things it can bill, and only 50 it can't justify. It will bill every other optional item to maximize its profit. So that is where there is a clear perverse incentive. And should there be a centralization? I don't know. But should there be a clearer management of how patients are managed and how they're cared for and how to bring down those costs? Absolutely. There is clear corruption across the system. You're probably well aware that many specialists in the country charge a file opening fee, a cash fee that's put aside, and that doesn't benefit the patient. That's purely abuse of the system.
Thank you so much for your time. And of course, the contention around the bill or the act now still continues, with the DA saying that they're taking it to court on review. That was Terrence Kommal, who's an extraordinary professor from the Northwest University and also CEO of Medical Expert Consulting.